Hello, in this video I'm going to be talking about artificial sweeteners and breast cancer risk. Before I go on, I'd love to invite you to subscribe to our channel and also a reminder to go to yerbba.com for your personalized report. So there are 6 FDA-approved artificial sweeteners in the United States. You will see on foods that might say sugar-free, and one of these 6 artificial sweeteners is probably giving the food its sweetness. So whether it's drinks, beverages, or cookies or candy, gum, you'll see sugar-free, and these are the sweeteners that are most often used. The one that we know the most about is aspartame in terms of cancer risk. So I want to cover epidemiologic studies in large groups of people and then lab studies. Epidemiologic studies are those in which we ask people about their exposures, certain foods that they eat or certain things that they do or areas where they live, and then look at the risk of an outcome, in this case cancer. And while we can't necessarily say in this one person, this exposure caused this outcome, we can make associations. One of the problems with epidemiologic studies is they can't control for everything. So there are things we can observe that we can control for, like exercise, smoking, that sort of thing. But there are other things that are confounders, they're called, that we can't control for. Things in the environment, things like other lifestyle factors, like even how much sleep somebody is getting. So epidemiologic studies need to be taken with a grain of salt, and they're often considered hypothesis generating, meaning more studies need to be done. There are some epidemiologic studies that indicate artificial sweeteners may be associated with, in particular aspartame, with a higher risk of cancer. But as with all epidemiologic studies, there's some weaknesses. So we don't know about the other things. What is it that prompts that person, for example, to use an artificial sweetener? Do they have other health conditions, other exposures that could also increase their risk of developing cancer? So those are epidemiologic studies, which I think are important as a rule, but in the case of artificial sweeteners, it's really hard for us to draw any conclusions. What about animal studies? Well, an Italian group published in the 2000s a study looking at rats exposed to aspartame. And in animal studies, investigators tend to use much higher doses and exposure than what we see in regular daily use. And one of the things that will be done is to give varying amounts where you increase the amount of the exposure, in this case the aspartame, and look at the risk of developing cancers. And their study suggested that in rats, given very high doses of aspartame, there was a higher risk of, in particular, blood cancers like leukemia and lymphoma. One of the things that you might be wondering as you're watching this is, why would people use artificial sweeteners? Well, some people with diabetes need to avoid simple sugars like glucose and fructose, and artificial sweeteners may be an alternative for them so that they can maintain good glucose control. And some people who want to take less sugar in will also use substitutes, and some people just prefer the taste to sugar itself. They prefer the artificial sweetener over actual natural sugar. So I just want to summarize, really we don't have any hard and fast evidence saying that sweeteners, including aspartame, increase the risk of breast cancer, which is probably what you're wondering as you watch this video. In general, we do try to avoid artificial chemicals in our life, right? We don't want to have man-made things in our body, but if you enjoy artificial sweeteners and you use them within moderate amounts, not a 12-pack can of soda with artificial sweeteners, I'm using the extreme here, it's probably safe. If you have special concerns We encourage you to talk with your medical team about the content of this or any other video. Drop a comment or question below. As always, we answer them as soon as we can, usually within a week or two. And don't forget to go to yerbba.com to get your personalized report. Thank you for watching.